We've gone to great lengths to be as ready as we possibly can with the resources that we have available at this time to us. Significant amount of planning, very detailed planning, preparation has taken place. And yes, I believe we're as ready as we possibly can be. First and foremost is making sure that our staff are aware that we will be facing an epidemic in the coming weeks. And that has meant additional education, training, making sure that the resources that we require are available to us, and of course forward planning to make sure that those resources continue to be available to us, so coming down the supply line. In addition to that, we've also looked at implementing our actual epidemic plan and taking aspects of that and implementing those aspects. We've also employed additional staff, and we've called for volunteers, particularly health professionals who've left the industry not that long ago, so we can bring them back in. The other thing I think which is very important is that we believe that the community should be actively informed as to what's happening. And we've been doing that through the media on a regular basis. An informed community is absolutely important to how we will beat this epidemic. They need to be with us, and we all need to be singing from the same songbook. Just a small correction. I've said volunteers, but in actual fact, they are actually support workers. What I want the community to do is to be informed. Number one is to watch the media and make sure that they understand what we're facing. Number two is to, and very importantly, is to look at the DHSS website, which will give all the information that anyone from the community actually needs. So somebody who is at home must self-isolate, and we've seen a lot of this on the national news and what that actually means. This is absolutely critical to breaking the transmission of this virus. Anyone who is not self-isolating, who actually can self-isolate, is setting themselves up for either themselves to get this disease or indeed to bring it home and give it to their near and dear. So number one, stay at home, self-isolate. For those who are home, who are not well or they feel unwell, then it's very important that they call either the hotline, and the number is available on those web pages I've just mentioned, or indeed call their doctor, and they will then get the information that they need what to do next. At Wimmera Base Hospital, we have set up a COVID-19 assessment clinic. This clinic is for anyone in the community who has had contact with a known COVID-19 patient or has come back from overseas and also has certain symptoms like perhaps a sore throat, a cough, or a temperature. Now, those persons meet the criteria for testing, and we will test them. And the test is really quite simple. It's just a swab from the back of the throat and in one nostril as well. We then send that off, and the result will come back 24 to 36 hours later. We will also advise the individual what they should do. Now, if they do meet the criteria and they do have these symptoms, we would advise them to go straight home and self-isolate and await the results. When the results come, if the result is negative, we will inform the individual, and obviously they should still self-isolate because that's what we're asking everyone to do. And those who are positive, or they receive a positive result, the public health branch of the Department of Human Services will contact them so that they can follow up on the contacts of that individual and trace them, because those contacts may also be positive and they will require testing as well. So that's what happens after the test result comes back. At the moment, the clinic is seeing about 20 to 25 persons a day. Of those, we find approximately 10 of them actually meet the criteria in some way, and those are the ones who are swabbed. To date, my understanding is that we have only had one positive swab return, and that was on an individual who actually comes from another town who came here because we had the testing clinic. The question really is, if we don't do what we're asked to do with self-isolation, what will the outcome be? Look, I think we're facing the potential of a major disaster. We have to do what we're told if we're to beat this epidemic. The prospect is that 60+% of the Australian population will get this condition. And of that 60%, a significant number will have a serious illness. Yes, it's true that the majority of those who get this condition will have a very minor illness. But of course, they get that minor illness and they pass it on to other people who then get a major illness. Those who get a serious effect from COVID-19 can end up dying. And we know that from experience overseas, the death rate from COVID-19 is around about 2%. 2% may not sound very much, but that's a huge number of people. It will and the number of sick that will need to come into hospital to be treated will completely overwhelm us. So it's absolutely imperative. I cannot stress enough how imperative it is that we listen to the advice we're being given by the Chief Medical Officer and the state health authorities. We must self-isolate. The more we can self-isolate, the better our chances are of reducing the impact of this epidemic. As well as the other things that we can do with regard to good personal hygiene, washing hands, any time anything is touched, etc. And coughing, of course, coughing into a tissue or coughing into your elbow, and then doing your hands again. There is no room for any kind of complacency with this epidemic. It is just too unimaginable what will happen if we are complacent. The coronavirus attacks cells in the lungs. I mean, it attacks the whole body, but particularly cells in the lungs. This causes a form of viral pneumonia, and in effect, the lungs cease to function. So it's acute respiratory syndrome, ARS. And of course, as the lungs shut down, the body can't work, there's no oxygen, and you die. Well, healthcare workers are clearly our frontline troops, and they are our number one priority to ensure that they fully understand what they're dealing with and they're fully protected. COVID-19 is a virus that is transmitted by droplets in the main. Droplets meaning that it leaves its imprint on any item that someone who has COVID-19 has touched or coughed over or put their hands in on their face and then put it on tabletop, etc. So transmitted by droplet. The key is to stop that transmission between someone who has COVID-19 and a health worker. And for that we use personal protective equipment, PPE as it's called. Now all health workers who will be dealing with COVID-19 have been trained to put on their personal protective equipment in the correct way and how to use that PPE. They're also trained how to correctly take off their PPE at the end of when they're dealing with a COVID-19 patient. That's absolutely critical. You don't want to become infected when you're actually taking off your PPE. Beyond that, that's really all that's actually necessary. There's still a risk. There is always a risk when you're dealing with an infectious patient. But good training, the correct application of PPE will protect a health worker. I think the important thing is that we recognize the job they're doing. It's a difficult job, and they are our frontline personnel. It's like the fireys are the frontline personnel with a bushfire. Well, this is just a different kind of bushfire. This is a bushfire that is going to go on for quite a number of months, and these are the people fighting that fire. The wipes and the hand lotions that we use usually contain the equivalent of 70% ethyl alcohol, and they're both antibacterial and antiviral if used correctly. I don't know of any other. The only other products, of course, soap and water to wash your hands. There is an argument that washing your hands with soap and water is actually better than the alcohol solution. And the reason for that is the soap on your hands actually takes the fat off your hands, or the grease, if you like, that can harbor the virus, as well as the mechanical action with the soap of rubbing your hands together actually flushes the virus off your hands. A consistent supply of hospital gowns. Look, the best thing I can say about that is at this point in time, we have adequate supplies for everything that we need, and arrangements have been made to resupply. And our understanding is that we will be resupplied. And I have confidence in the state authorities that they are doing whatever they need to do to ensure that we have all the resources that we need.